In starting insulin therapy, it's crucial to determine the right total daily dose for each patient. The basal bolus method is a widely used approach that helps tailor insulin to individual needs. To begin, we estimate the total daily insulin requirement based on body weight. The typical formula is simple: multiply the patient's weight in kilograms by 0.5 units per kilogram. For example, if a patient weighs 72 kilograms, the calculation would be 72 times 0.5, resulting in a total daily dose of about 36 units. This estimate serves as a starting point and can be adjusted as needed for each person's response and lifestyle. Once the total daily dose is calculated, the next step is to split it into two main parts: basal and bolus insulin. Basal insulin makes up half of the total dose and is usually given once daily at bedtime, helping to maintain stable blood sugar levels throughout the night and between meals. The other half is bolus insulin, which is divided among meals to manage the rise in blood sugar that comes with eating. For our example, with a total daily dose of 36 units, 18 units would be basal, and the remaining 18 units would be split as bolus doses before meals. This division helps mimic the body's natural insulin pattern. For bolus insulin, the dose is typically divided before each main meal. In our example, that means about 6 units before breakfast, lunch, and dinner. It's important to inject mealtime insulin roughly 15 to 30 minutes before eating, especially when using regular insulin. Also, injections should be spaced at least 4 hours apart to avoid overlapping effects. This basal bolus method offers a simplified yet effective starting point for insulin therapy, allowing for adjustments based on blood sugar monitoring and individual needs. With careful calculation and timing, patients can achieve better glucose control and improve their overall health.